how it lies into the body, in the bicep region, looking at the carry angle, the normal carrying angle is somewhere between 5 to 8 degrees. Some of those need excessive angles, especially a little bit higher than some women. Looking at the overall muscle area, so bicep here, looking posterior into the tricep, looking for any atrophy or hypertrophy. I'm also going to be notating atrophy or hypertrophy over here, so all my wrist flexors are going to go to the medial epicondyle. All my wrist extensors are going to go to the lateral epicondyles. Once again, look for ecchymosis, but not ecchymosis, but atrophy or hypertrophy. I'm also looking at the skin subcutaneous for edema, ecchymosis, erythema, or any kind of lesions that might indicate kind of trauma or any old surgeries.
Palpation, bony landmarks, muscular insertions, ulnar nerve.
All right. So the bony landmarks are going to be primarily the medial epicondyle up through here, the lateral epicondyle back over here, and then the olecranon through here. Not too many landmarks you need to worry about. The muscular insertion part, I need you to worry about kind of the wrist flexors, so up and through here, notating any kind of pain, and the wrist extensors over and through here. On the anterior part, you can kind of push up through here, give me a little resistance, and when I do that, I'm going to feel down here, so I'm feeling the insertion part to the bicep tendon, and then just the opposite, I'm going to go to the posterior region right there, just superior to the olecranon, notating the tricep tendon.
Range of motion, active and passive. Elbow flexion, elbow extension, forearm pronation, and supination.
Okay, so what you can do is flex up your elbows as much as possible.
Ulnar nerve.
Oh, sorry. So when I'm palpating the ulnar nerve, thanks guys, is I'm going to palpate right there in the cubotunnel, notating any kind of hyperesthesia. All right, now let's go to the flexion of the elbow. Perfect. I'm looking here on both sides, extension of the elbow. Good. Now what I have you do is bring your arm to your side, like this right here. Start in the neutral position up and down. Maybe turn your palms up into supination. Bring it back to neutral. Turn your palms down into pronation. And compare bilateral. Strength test.
Strength.
So what I have you do is kind of bring it up through here. I want you to hold it, it'll move you. Extend, or I'm sorry, flexion, elbow. Then bring it up a little bit, pushing my hand. Good. An extension, compare to the other side. Then I have you hold it through here. So I'm going to have him go into pronation, and I'm going to resist against him. So I'm testing out his perfect, turn it perfect, just like that. Now I'm going to have you attempt to turn into supination, and I'm going to resist against you. So I'm testing out his supinators there.
Special tests. Valgus, varus, elbow flexion, long finger, wrist flex, medial epicondyle, wrist flex, wrist extension, lateral epicondyle, and Froman test.
Okay. So let's do my varus valgus first. So I'm going to hold over on this side through here, and I'm going to attempt to push the hand out in this direction here while I'm pushing the elbow in there. So I'm giving him a nice little valgus stress, testing out for the ulnar collateral ligament. I'm do just the opposite now. I'm going to push the wrist in, push the elbow out. So I'm giving the varus stress, testing out for the lateral collateral ligament going up through there. After that, we're going to bring the arm up through here. I want you to bring your wrist up into wrist flexion. Hold it there. Don't move you. I'm going to attempt to bring them up to here, and this is going to notate pain right here, just distal to the medial epicondyle or medial epicondylitis. What I have you do this opposite. Bring your wrist into extension. I want you to hold it there, don't move you. And now I'm going to give him resistance, and he's going to notate pain just distal to the lateral epicondyle for lateral epicondylitis. The other thing I want you to do now is kind of bring your hand up through here. I'm going to push down on his third digit, and that's going to be the extension digitorum communis. And if it resists, if it's painful while he's pushing into extension to this area here, we're going to say positive for lateral epicondylitis again. After that, I want you to bring your elbow up. And I'm going to, well, actually, we'll have you seated argumentatively. Seated in the chair next to the table, so pretend like you're sitting. Face me, put your elbows up on the table. And flex them up maximally. Perfect. Hold there for 60 seconds. Let me know if you have any numbness and tingling. If he says he has any numbness and tingling, ask where. To make it positive, he's going to talk about the fifth digit, and then half, or the medial aspect of the fourth digit to make it positive. After that, we'll have a sheet of paper. I'm going to have you grab onto the sheet of paper, and I'm going to attempt to pull it away from you, much like this right here. It's the Froman sign. What would make it positive, if he had the ulnar nerve neuropathy, is that he would flex up at the IP joint there. Okay? Notes now?
Notes and L's listed.
Okay. You got them?
Which one is this?
Okay.
Hand and wrist. Inspection.